I'm Dr. Mary Wells. I'm a pediatrician with Accordia Midtown Pediatrics. We're a new pediatric clinic at Airport and Azalea Road. We are as a federally qualified clinic. You can see us regardless of your ability to pay or your vaccine status. But I'm here today to tell you that, hey, it's time to get on it for your child's back to school vaccines. The ages for those vaccines are at 4 years old, 11 years old, and 16 years old. So make your appointment so we can get you healthy.
Hi, my name is Dr. Tonya Dobbs. I'm a pediatrician with the Family Health Clinic here in 8 Mile. As the students get ready for the upcoming school year, we encourage all families to check in with their child's healthcare provider to make sure that they do not need an updated checkup, and also to make sure that they have received all of their childhood immunizations. For children entering kindergarten, they would need potentially 2 vaccines, their MMR and their varicella, which is their measles, mumps, and rubella immunization, and they will potentially need their DTaP and their polio, which helps protect against diphtheria, tetanus, and pertussis. For children entering middle school, ages 11 to 12, they are required to have their Tdap vaccine, which also covers tetanus, diphtheria, and pertussis, but we do also recommend 2 other vaccines, the meningitis vaccine and the HPV, their cancer vaccine, if they have not already received it. Hopefully everyone is getting prepared and has a great upcoming year.
Hi, I'm Dr. Chiquita Anderson. I'm Chief Pediatrician here at Franklin Primary Health. I wanted to talk to you today about back to school vaccines. And so school starts, I believe, here in Mobile on like August 10th, so we're not too far away. But now is a great time to go ahead and schedule your well child appointments. And so we can examine your child. This is an opportunity to talk about your child's health, answer any questions you may have, but then also to look at their vaccine record, okay? We don't want you to go to school the first day and not be able to start because we're behind on vaccines. So now is the opportunity to go ahead and schedule those appointments. To schedule an appointment here at Franklin, you can give us a call. A number is 251-432-4117. Once again, that's 251-432-4117. Give us a call, go ahead and schedule that appointment. Oftentimes we can do same day appointments, and oftentimes we also can do walk-in appointments, especially for children entering kindergarten, those going to 6th or 7th grade, 11 and 12-year-olds, they'll be due for their vaccines too, okay? You don't want to wait to school starts, I would say, because then you're missing school, trying to get in for an appointment, and those are instructional days and time that's lost. And so to try to prevent all of that, it's important that we plan ahead. You can go ahead and schedule those appointments to get in now.
Hi, my name is Dr. Aaron Chinners, and I'm one of the new internal medicine and pediatric physicians here at Mostellar Medical Clinic.
Hi, I'm Dr. Gurung. I work as a general pediatrician here at Mostellar Medical Clinic, which is one of the FQHCs in the area.
So we're getting close to the start of the school season, and so we wanted to come on and talk with you guys about some things you should be thinking about for your pediatric patients.
Right, so as August is almost here, which means back to school season, do you have any insight or any advices for the parents before the first day of school?
Absolutely. So one of the most important things that you can do for your pediatric patient or your pediatric child is to make sure that they're up to date on their vaccines before they get back to school. Not only is it important for the school system, it's required for the school system, it's also important to keep both your child and the community safe.
That's right. And why is it important to talk about vaccine during this time is because when school starts, children spend a lot of time together in classroom, in cafeteria, and in playgrounds where the illnesses can spread very quick. Like, for example, last year we had an outbreak of whooping cough in the community in our local schools, and many kids got really sick. They missed many days in school, but that also put our infants and vulnerable population at risk to catch the infection and develop complications. And that was a strong reminder that these vaccine preventable illnesses are still very much around us and can spread quickly when they get the chance.
Absolutely.
Dr. Chinners, so many parents worry about the safety of these vaccines. What do you have to tell them?
Yeah, absolutely. You know, a lot of people do worry about the safety of these vaccines, but what we can tell you is that these vaccines are not new. They've been around for a long time, and they're continuously monitored. Before even getting into, the clinical setting, what I mean by that is we give it to a patient, they were tested and tried even before that. So we can tell you that they're very safe, and what we can see on the outcome is that they protect people from these illnesses that are overall preventable.
Right, and if parents have any questions regarding the safety of these vaccines, it's a good time to discuss those with their pediatricians. And if you are looking for a new doctor, we are available here to discuss these questions with you.
Absolutely.
And so parents may not know what vaccines their children need at this time, so I think this gives them the opportunity to go over their shot records and catch up if they need any vaccinations before school starts.
What kind of final message would you give to families as we're getting close to the school system?
Really, the things that we discussed, that instead of waiting till the last day before the school start, I think it's a good time to call your doctor to schedule those appointments, to review the vaccines, to see if they need any hearing or vision screening done, or they need any referrals updated, sports physical evaluation needing to be done before the tryout. So it's very important time at that before, parents are busy buying all the school supplies, but I think it's also an important time to schedule their appointments and just get those done so that they can have a healthy school year.
Absolutely.